listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.
Thank you for listening to Community Forum. My name is Johnny Chandler. I'm the owner of KCCC 930 AM, the host of Community Forum. With me today is Dr. Peter Jewell. Right?
Yes, sir.
Which some around here have already told me you're the Jewell of Artesia General Hospital.
I don't know about that, but there are a lot of rumors going around about me, so you never know.
Right. Well, except the good ones, right?
Exactly.
Deny the bad ones.
Yes, sir.
So Dr. Peter Jewell, who I will reference as Dr. Jewell for the rest of the interview, is a primary care family medicine doctor here at Artesia General Hospital.
Yes, sir. I see a little bit of everything, diabetes, hypertension, back pain. I do small procedures like remove skin lesions. We do biopsies on those. I'll send them off
so
to
it's
pathology.
like you remove moles and stuff like that. So almost like a dermatologist.
I wouldn't quite go that far because a lot of times what happens is if I find cancer, a skin cancer, I'll probably refer to the dermatologist.
But maybe like just a cosmetic procedure, you'd be like, hey, I've got this mole. I'm not really concerned about it, but I don't like it.
Yeah.
Right. You can take care of those things. Now, I'm an extremely white Irish heritage person, so I'm a pretty frequent visitor to the dermatologist, something like that. Just got to check it out all the time. Plus, I really love the sun.
I understand.
You know what I mean? So it's like between those two, you really just got to pay attention.
And if you're my age, back in the day, nobody knew all the dangers of the sun, so we'd all be out all summer long, shirtless, hanging out in the sun, worshiping the sun. So yeah.
Well, that vitamin D and the energy that it provides to you.
Exactly.
Right. You just got to. I mean, I'm an SPF 50 guy minimum all the time, and I'm still getting color related to that, even with that much sunscreen on.
I'm not far from you.
Yeah.
I have dark hair, or did have dark hair, but I got sunburned very, very easy.
Yeah, and I
always walked around red.
And I have blonde hair, almost clear sometimes, and so I have to wear a hat, or I'm getting sunburned on my head.
Yep. In fact, that happened to me on Saturday. I forgot. I walked outside and thought I was going to be outside for 20 minutes, and 3 hours later, I could feel it when I took my next hot shower.
Yeah, right. Now, so this is not necessarily off topic, but it's interesting. So, I get a sunburn when I was younger, right? And my mom's sister, Aunt Marianne, right? She told me after I get a sunburn that you should take a hot shower afterwards because that's gonna help like cure the sunburn faster, right? And so I was like, all right, I'll take a hot shower. And it was like one of the worst showers I ever had in my life because everything was burning up. But actually, it took me years and years to realize that she was just messing with me.
Yeah, I think so.
Right. my evil aunt, right?
Like, ouch. That's all I can say to that.
Right. I was like, so Dr. Jewell, tell us a little bit, before we started recording, you mentioned that you've been in New Mexico for a while, but I want to go a little bit farther back than that, right? Where did you go to school in general? So you actually had two careers, a brief one at the beginning, which you mentioned, which I want you to tell everybody about as well, because it's so relevant to what we're doing today. But where did you end up going to college?
Originally in Chicago, I went to a college called Columbia University, and I, believe it or not, was on the radio for about 5 years.
5 years.
When I was in Chicago, I worked for a talk show as a producer for a little bit. And then when I moved to Colorado in 91, I worked for a small AM station. At the same time, I was working for an FM station too, FM and AM on air. So it kind of changed a little bit. The AM station, I was doing a talk show for a bit, and the FM station was kind of top 40.
Right.
So yeah, that was about 5 years, but I found that to get anywhere in that business, at least back then, 30 years ago, you had to stab your best friend in the back to get anywhere. And I wasn't willing to do that. And I kind of went back to school. I'm going to say actually 40 years ago, roughly, is when all of that was going on. But decided to go back to school because I enjoyed helping people. And
journalism to medicine.
Yeah,
right.
Big difference.
So journalism, I went to journalism school, right?
Yeah, yep.
Not really technically challenging necessarily as far as I had to take almost no math in college in order to get my journalism degree, right? Like there were some things that I didn't have to do that some other majors and other careers did, right? So a lot of times I'll say like those liberal arts degrees, right?
Yep.
Or like phoning it in. It's like the easy path in college in a way. And I'm going to say that because I took it, right?
Yeah. Yep.
But the idea is, so how do you go from what generally is a much easier degree path than medicine, right? So like the mental acuity, I think, necessary to become a doctor compared to a radio talk show host or some type of journalism major, I think is quite a bit different.
It is a big jump, but it was actually suggested by a couple of my career counselors in college that I should think about getting a minor in science.
Okay.
And I came very close to doing that. But after being in the business of radio for, like I said, 5 years ago, I just found that it wasn't me. And a lot of what I was doing on the radio was helping people, doing that talk show. You had mentioned the community efforts, and that was mainly what I was doing. Community focus and trying to help people out. And I just said, hey, I'm going to go back to school. When I first was going to go, the big in-field then was physical therapy. And I really, really considered that and started taking some of the classes that I would need to get into grad school, and found that I needed the same classes for becoming a physician. And so I have a degree in communications, and I almost have a second degree in biology. I'm about 3 credits shy from getting a second degree. But when I was going there, I changed kind of my focus, and I decided I didn't want to become a physical therapist. I wanted to become a full-fledged doctor. And so I focused more on that.
Right.
And took my MCATs, et cetera. Then long story short, here I am. We were talking previously about me working in Roswell, and I found here is more community-based. I kind of enjoy that a little bit more. It's more focused on the patient, as I like to spend a little bit more time discussing things and explaining certain diagnoses, and then also explaining why we're doing certain medications and what these patients can expect from the typical medications, typical side effects, those kind of things.
Right.
And tell them how it works as well, too.
So the Eastern New Mexico Medical Center, right? That's the one in Roswell?
Yes.
We're not talking bad about any hospital system.
No.
Every community that has a hospital system, we should be grateful that we have one.
Yeah, no,
right?
I agree. It just, when I worked over there, we didn't have as much time to spend with the patient.
Right. So how many years did you spend in Roswell?
18.
And then what I wanted to do is I want to trace that back to where, first of all, you went to school at Columbia University, but in Chicago, right?
Yeah.
So you could say Columbia and then have like the accolades of thinking that you went to Columbia.
No. CU in Colorado.
Yeah. So that's where you went. So, Boulder.
Mm-hmm.
Right. Anomaly of a town the first time I ever went there, right? It's like smaller than you think, but there's just incredible amount of money up there.
Yeah. In fact, I believe it's one of the most expensive cities to live in.
Yeah, I do. I think so. And then, of course, you got to think about the South Park guys, right? That's where they came from, right? So they produce a wide array of graduates at CU Boulder, right? So how did you end up coming to New Mexico when you have roots in Chicago and Colorado?
Residency. I wanted to work in rural medicine. That was when I switched gears and decided that I wanted to do medicine. I really wanted to work in underserved areas. So I applied to rural programs. I applied to a program in Pueblo, Colorado. Mm-hmm. I applied to a Roswell program, and the Roswell program was what they call a 1+2 program. So the first year I spent at UNM in Albuquerque, and the next 2 years I spent in Roswell. And that's what more or less drew me to Roswell. All the patients that I was seeing as a resident were all telling me, hey, we have a huge need for doctors. And I decided to stay because of that reason. And you're planning on staying. I kept getting that question over and over again. And I said, yeah. And I more or less, even here in Artesia, have still done that. In fact, I would say that about 40 to 50% of my patients that I was seeing in Roswell have followed me down here. In fact, they were kind of, what's the right word? They were very impressed my first couple of weeks that I had already had a full schedule.
Right. What do you mean when you came to Artesia?
Yeah, right. From the first week, I was seeing a lot of patients.
Right. Well, that's a testament to the care that I guess maybe in your industry, it's going to be the bedside manner, right, that you give related to the training or related to the treatment of the patients.
And let's face it, I have medical issues myself, and I'm a patient, and I want to treat my patients the way that I like to be treated.
Right.
And that's also the way that I base my referrals on too. The feedback that I get from my patients. Am I willing to send them to this doctor or that doctor? Well, it depends on what I hear back from the patients that have seen them.
So you mentioned that you're a type 1 diabetic. Is that what you said? Right.
Yes,
and
type
then
1 diabetes.
before we started recording, you said that you were diagnosed with that when you were 11.
11 years old.
Right.
Yes.
So I think all of us are very familiar with type 2 diabetes. I think that that's been very prominent. Some of that is diet-based, health-based, stuff like that. I mean, I think that all the GLP-1 medication commercials that you see is probably driven towards a type 2 diabetic type individual when it comes to weight loss and that type of thing. Am I right or wrong about that?
You're right about that. It's not even really recommended for type 1 diabetes. However, you can go off label. You as a physician can make that decision if you think that the patient's going to do well with it.
Right. So do you have maybe a natural passion to help patients who are diabetic?
Absolutely.
Whether that's type 1 or type 2?
Absolutely. You know, I either work in conjunction with endocrinology or sometimes depending on how the patient feels and how well that they're taken care of or how well that they're controlled.
All right. What do you mean by endocrinology?
That's a specialist in diabetes, specialist in hormones.
Okay.
Yeah.
All right.
Yeah. We have a good one. We have a good one here, Dr. Ferraro.
Okay. One day, Kush, I'd like to interview Dr. Ferraro. Right. Oh, he's not on the radio, but he's sitting in the room with us. So just so everybody has a reference.
And I refer to Dr. Ferraro as well too.
Right.
So yeah, and he also takes endocrinologists also do a couple of other things as well too, like Cushing's disease, and that's a disease where you're producing too much cortisol and it causes all kinds of issues, hypothyroidism, parathyroid issues with too much calcium buildup, et cetera. So he does more than just diabetes. But that's what you would call, quote unquote, an endocrinologist.
Okay.
And I considered going into that, but diabetics sometimes they don't always follow orders,
right?
And myself included. So I did not want to face that every day. Plus, I'm the type of person that needs a little bit of variety. I get bored doing the same thing over and over and over again. So yeah.
Like being a primary care family doctor, right? Mm-hmm. I mean, that's like the general knowledge that you have to have of most things is pretty expansive as opposed to just going into a specialty.
That's the wrong way to look at it because a specialist, the reason I refer is if they need a little bit higher acuity in that area. Right. Like I certainly wouldn't want to try to take care of somebody that needed, repair on their anterior cruciate ligament. That's just out of my scope of practice.
I don't know what that is. What is that?
The football injury. That's what the NFL players get repaired all the time. It's a tear of the ligament.
Like a baseball player and Tommy John surgery has become pretty normal. That. Yeah,
exactly. So that's way out of my field. Or let's say if somebody needed to have open heart surgery, I would not feel comfortable doing that. But a lot of the times the diagnoses to that point come from me.
Right.
They come in, they can't walk, they're having problems, their knee locks up, whatever. We'll do an MRI and that will show us, hey, yeah, the patient has an anterior cruciate ligament tear or posterior cruciate ligament tear, that kind of thing. So I make those diagnoses and then hand off to the next person, shall we say.
Let's bounce around a little bit more. You said you did a year at UNM. Right.
Yes.
In Albuquerque. I lived in Albuquerque for 20 years.
Yes.
Right. So I'm very familiar. My family still lives up there. I like Albuquerque quite a bit, actually. I did pretty well for myself there also. Did you get to do any time in the emergency room?
Of course.
Yeah, right.
Saw some interesting things there.
That's not, so the rumor is, right, that that is one of the emergency rooms that if a doctor wants to be an emergency room surgeon, physician, or whatever the official term is, right, if they want to spend their career in an emergency room because they get the adrenaline rush from emergencies or something like that, right? That is a really good emergency room to work in because you see just about anything.
I did 2 rotations in emergency there and 4 rotations in emergency in Roswell. So yeah, I spent a good amount of time there.
Right. So you've seen some pretty crazy stuff then.
You could say that.
Right. I mean, we're not going to
gunshot wounds.
Stab wounds, gunshot wounds, drug overdoses.
Yes, sir.
So, Albuquerque, I lived there a long time. I can say this. It's a bit of a gnarly place, or can be.
Can be.
Yeah.
It can be. But that's the same as everywhere. I lived in Chicago for a while.
Yeah,
and there are parts of Chicago that are gnarly.
Yeah, right.
And that's putting it mildly. So, yes,
right.
sir. Yes,
yeah,
sir.
that's a good point. But, that's so I think about think about a dentist, right? There's nothing I would like less than to be digging around and drilling into somebody's teeth, right? But the dentist actually really enjoy that type of thing.
I would say yes.
Right.
I couldn't, I'm somebody that likes to help people get away from pain. I mean, I can't imagine inflicting pain.
Oh, okay. Right.
So I couldn't be a dentist. I'm going to be completely honest with you. I couldn't do that.
Genetically, our family does not really have great teeth. And then I also decided that it would be a really good idea to chew tobacco for like a decade.
Oh,
right?
yeah, that'll do it.
Yeah, so as a result, I'm in the dentist chair quite a bit and gotten quite used to it. You know, you could give me 10 shots in the mouth, it won't even affect me. I mean, I'll get numb, but it won't bother me anymore. Okay. But the minute that you draw blood from my arm, I pass out. You know what I mean? So it's just a matter of what you've gotten used to. You know what I mean? It happens quite a bit.
Funny thing is, you know, it's mainly the male patients that pass out when they get blood drawn.
No, I pass out every time.
Yeah.
And they freak out on me too, like the doctors. You got to warn them. Right? I have to lay down in order to get blood drawn now, or I'm definitely going down.
I can tell you as a whole, women definitely have a higher pain tolerance than men.
No, I mean, that kind of makes sense too, considering the whole childbirth thing and everything that they typically go to. It makes a lot of sense. So let's get back to diabetes, because you're passionate about that. You yourself are a type 1 diabetic. Does that mean that you're always on something, right?
I am connected to an insulin pump that gives me minute portions of insulin throughout the day.
Okay.
It's made my life a lot easier. I kick myself now because it was kind of advised to me when I was in residency that I should wait until the residency was over before I started on an insulin pump. And had I listened to the first bit of advice, because, you know, everybody's got their own mind on what is best for you. But the first bit of advice said, yeah, you probably should consider it. And then I had other doctors tell me, hey, you know, you probably should wait until residency was over. It makes, if nothing else, it makes my life more convenient, because having to carry your syringes around and vials of insulin, et cetera, you leave the house, you think you're going to be back in 20 minutes, and then 4 hours later, you got to eat, but your insulin's back at the house. What do you do?
Right.
You know, so now I've got about a 3-day supply connected to me at all times, and it just makes it easier for me to live my life. Even though I'm a type 1 diabetic, which many people ask me, what's the difference between type 1 and type 2? Type 1 is completely insulin dependent. My body no longer makes any insulin, period. Type 2, your body usually overproduces insulin, but your cells become resistant to that insulin. And that can happen for a lot of different reasons. Genetics, it can happen because of lack of activity. It can happen from certain foods we eat, all of those different things.
Now, not type 1, though. Type
type
1 is what? Is that completely like genetically based? Or?
No, not necessarily. What the current thinking is right now, the scientists are saying that at some point in my life, I caught either a bacterial infection or a viral infection. And my antibody started attacking that infection, but at the same time, it attacked the islets of Langerhans, which is what makes insulin. And over a period of time, it attacked it to the point where it no longer worked. So that's when...
Just shut it down.
Just shut it down, yeah. And so now I require insulin always. So unless they come up... There's a lot of research going on now that they have now a beta cell transplant that they've done with, I think, 12 patients that has shown promise. So who knows what the future holds. But right now, I would say the best mode of treatment is insulin pumps.
So let's talk a little bit about type 2 diabetes then. And I wanted to ask, like, how big of a problem is type 2 diabetes in our community or our country, whichever one you want to address?
Both are a huge problem. Epidemic proportions, you know, there's some estimates that they think about half of the population is diabetic now. Some estimates. I don't know if I completely believe that, but there are a lot of people that are non-diagnosed. You know, the most common symptom in type 2 diabetes or type 1 is having to urinate frequently, not being able to quench their thirst. And people don't realize that, hey, you know, if I'm having that, it's not necessarily your kidneys or your prostate. That's usually what they think. It can very well be diabetes. Fatigue can also be another symptom of diabetes. And who doesn't have fatigue these days?
Right.
Everybody, right? Weight gain, you know, in type 2, weight loss in type 1. But, you know, it's just kind of a lot of different things, and people don't really put 2 and 2 together. Or there's a lot of people that don't, you know, are afraid of doctors. And that's what I try to alleviate when they come to see me the very first visit. I always tell patients, look, no such thing as a stupid question, only stupid answers. Ask me anything, because that one thing that you're holding back might be that key that I need to open up the box to help you feel better and live longer.
Right. Well, that's what I do for this show. There's no stupid questions.
That's right.
Right. I was like, just whatever's curiously on my mind is how we'll do it. Right.
Exactly.
So how long have you been with Artesia General?
2 years. I'd like to finish out my career here. I've got anywhere between, I'm going to say 10 years to maybe 15. It kind of depends on how my health goes. Right.
Right.
But I'd like to finish out my career here. I don't want to move again, and I haven't changed residence yet, or because I live in Roswell.
Okay.
And the main reason why I do that is because I got about 2% on interest on my house.
I get it.
And I only have 6 more years to pay. And it's just I don't want to mess with that.
It's hard to leave a house when you bought it at the good interest rate.
Exactly.
Yeah, especially we have 3.25%, my wife and I, on our house in Carlsbad. Right.
Nice.
And I'm just like, how are we gonna we're gonna sell and go get 8%, or I have good credit, so maybe 6.5%.
Yeah.
Right. You know what I mean? It's just, and then the cost of the house that we're affording now, it would be like double the monthly mortgage it is right now. And then, I mean, the commute from Roswell to Artesia is like how long?
It depends on the day, but I would say anywhere between 40 to 50 minutes.
Yeah, that's not really all that bad.
It's not bad. And where I grew up, I had mentioned before that, I lived in Chicago. And I'll tell you that it could be 2 hours to drive, we're going to say 30 miles. Depending on traffic. Yeah. So, I'm driving 42 miles. So it's really not that bad because there's not that many cars on the road.
Yeah, but it's all relative, right? It's whatever you get used to.
Yeah.
Right. You're in Chicago. I was in California a few weeks ago for my buddy's wedding.
Oh my gosh.
We're in San Diego and we go up to Temecula. Oh, that's not that far. No, it took me 20 minutes to go from one store to the next store, right? Like from a TJ Maxx to Nordstrom or something like that. It took me 20 minutes. They were literally like a 5-minute walk away. The traffic's insane.
2 years ago, I went to see a concert at the Hollywood Bowl, and it literally took 2.5 hours to go 13 miles.
Yeah, right. Well, that's LA too.
Yeah.
Yeah, that's much worse than San
Diego
Diego, or the Bay Area is pretty bad as well. So I wanted to ask you, what is let's ask like a couple, what is the one thing that you, as a doctor here in Eddy County, thanks for practicing here in Eddy County, right? We appreciate it. What's the one thing that you would get, if there's one thing that you would suggest to people in the community about potentially staying healthy?
Exercise and diet. I mean, those are the two big things. I mean, that can, and at times, be some of the things that lead to, say, type 2 diabetes, hypertension, back pain, knee pain, hip pain, a lot of the pains, because if you're heavier, that can put undue stress on your joints.
Right. So exercise could be, you're not talking about going to the gym and lifting weights like a body, but I mean, this is something that's like a nice evening stroll.
Yeah, not necessarily. It doesn't have to be lifting weights. I mean, it can be. I mean, whatever you enjoy doing. I mean, that's what I recommend. And in fact, when I give that advice in my clinic, I'll tell a patient, look, start with 5 minutes, or even less than 5 minutes. Walk around the block, walk from your door to the mailbox. That's a start, and then your body's going to be telling you, hey, maybe I can do more. And then slowly but surely you do a little bit more, kind of like that thing.
And then eventually your body could even get addicted to the physical activity that you're doing. It takes a while. So there's about 3 years ago, I wasn't doing much physically, and I'm a naturally skinny person. Genetically, our families are pretty skinny. So you feel like you're good, right? You feel like you're strong. And then I was like, I just want to start doing push-ups every morning, just a little bit of stretching, a little bit of push-ups, right? And I was like, I'm just like 40 years old, and I was only able to hammer out like 10 push-ups. Mm-hmm. You know what I mean? I was like, wait a minute, I thought I was a little stronger than this. But as I kept going and I was able to move it up, and I could do 30, the snap of a finger now, really knock it out. But then I also tell you, I went stand-up paddleboarding, right, on the river in Carlsbad, which I really enjoyed doing, but we hadn't done it for like a whole year, right? And then it makes you realize how out of shape you were.
Yeah.
Like that was like, you don't do one thing for a year, even if you are somewhat stronger in shape or swimming in the pool all the time, right? The idea of that muscle memory of those muscles and the activity that you're doing just seems a little bit different.
Yeah, you're using muscles that you haven't used before, especially those core if you're doing the stand-up paddleboard.
Yeah. No, that's what I want to show my wife is a good core, right? It's like
You want that six-pack.
no, it's just flat. It's like that's a lot more work for the six-pack than I think is worth it in my life at this point in my life.
I understand.
You know, you specifically mentioned earlier, we've got a few minutes left. You mentioned earlier that you found a passion in rural medicine early on, right? So what about rural medicine, besides maybe the idea that some medical school can get paid for when you go to a rural community or something like that, right? Like why rural medicine is a passion when you obviously have the ability to live anywhere that you'd like?
I like taking care of patients from the time that they're young until, they get much older. I like that variety, and it just gives you that chance to know the people outside of work as well, too.
So you do pediatrics all the way up to adulthood or not? I mean, I don't know if you technically do pediatrics, but if you're talking about their whole life, then I guess you do.
Yes. Yeah, I do. Anything over the age of 1, I see people from 1 to 101.
Well, that's why you would have so many patients follow you down when you came to Artesia General, right? Because you've created that culture already.
My oldest patient that I had lived to be 106 so far. So, yes, sir, I see every age.
Well, that's pretty good. I don't know if 106 is in the cards for me. I mean, mind over matter, right? I mean, tell yourself you're going to live to 106 and maybe you'll make it.
They're coming up with all kinds of new procedures and all types of new medication that's supposed to help keep us young. So you never know what's down the road.
What do you think about these medications where they help you, but you have to be on them for the rest of your life?
Personally, I try to prescribe as few medications as I can. But that doesn't always work out. There's some patients that may even have 2 pages of medications because they have kidney failure, they have diabetes, they have hypertension, they have high cholesterol, they have maybe on chemo drugs. You can go on and on and on and on.
Right.
So it kind of depends on the patient. But I'll take myself for example.
Right.
I'm going to be on insulin for the rest of my life. So I think it depends on the medication is what the answer that I would give to that.
Right. If you had to do it all over again, right? I'm not going to ask you if you would choose rural medicine. I think you would. But is there like something that you're mostly interested in that if you had to start over again, you might go down that path?
If I could go back to the time that I was maybe 10 years old, I would push myself to play football more because I miss playing football.
Like you're talking about American football, not soccer. It's World Cup right now,
NFL,
so I'm thinking about soccer.
NFL, yeah, not soccer.
Yeah, we lived in Germany because my dad was in the Air Force, and we moved to Altus, Oklahoma, right, which is the Air Force base there, just on the eastern side of the Texas Panhandle. And I signed up for football, but I never played football before. I played baseball growing up, right? And I walked in to the locker room, and I saw the biggest, like, offensive lineman-looking dude you could ever see in your life. And I'm in the 8th grade, and I had not grown yet. Yeah. Right? I was a late bloomer. I was really small. I immediately turned around and went to off season. And I was like, I'm going to do basketball and I'm going to do baseball. And so when you think about those type of things, and I just say that and tell you that to try to relate to you as somebody I just met, but then also to the audience as well, the listeners, is the idea that I also wish that I would have given it a shot.
I was never any good at basketball, so that wouldn't have been in my future. No way. But I was pretty good at football.
Now, I thought I was going to be good at basketball. So my dad was 6'4", even though I hadn't grown yet. So I was like, I'll get some height to me. You know what I mean? And I did. By the time I grew, people were dunking on me already. So I was like, I'm done. I was like, I'm not going to figure that out. But baseball, I stuck out with for a while. Are you still accepting new patients? Are you full, or how does that work for you?
Always taking new patients, yes, sir.
Okay. Is there some information you want to get out to the community on how they can find you? If they, you're looking, if you want a doctor for the next 10 or 15 years, as you stated, right, then Dr. Peter Jewell is somebody you should look into.
So the easiest way to get in to see me is to contact our office, 746-3119, and ask for a patient packet. They kind of want to know I want to know what kind of medications you're on and what kind of insurance you take, et cetera. And
right. I
think we take every insurance, but I'm not absolutely certain.
Well, as a nonprofit, I'm sure there's a whole array of insurances you're required to take or the board wants you to take anyways.
Mm-hmm.
And so that makes a lot of sense. So we're just about out of time, but I do want to give you basically the last word. It's my show, so I'll probably have the last one, but you know what I mean? Like
of course.
The last word for you. Like, is there anything else that you want to say that we didn't talk about? Anything you want to mention?
Well, there's a lot of different things that we kind of just briefly touched on. My job is to diagnose what your issues are. And if you're having a lot of things, fatigue, frequent urination, high blood pressure, headaches, whatever, get in to see me or a primary care physician so that we can start working you up and figure out what's causing that. And then, if I can't handle it, if it's something that's above my scope of practice, I'm going to end up, referring you to somebody that is really good. We have a lot of good doctors here in Artesia. It's a good area to be. I will definitely send you to some top-notch doctors to help take care of you, or I'll take care of you myself.
And the way that you care for people in the community and your patients, it just comes through naturally, right? Especially when we're talking. And so Dr. Peter Jewell, the Jewell of Artesia General Hospital, if that's not a moniker, it needs to be, right?
A perfect name for radio too, but I couldn't do it.
That's okay. Well, you get to do it now.
There you go.
I invite you to come on the show anytime you'd like, right? And especially if there's like an issue or something floating around that you really want to get out, let me know. We're for the Eddy County community, right? We're within an 80-mile radius over the air. We're online, everywhere you can think of on social media. I wanted to appreciate you and say thank you very much for coming on the show.
Thank you for having me.
All right. And then it's been very nice to meet you.
Good to meet you too, sir.
You're listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.